For decades, the world fought HIV like it was a single terrifying emergency. But what happens when that emergency is over? Today, we're going to dive into one of the biggest success stories in modern medicine and the really unexpected challenge that success created for health systems all over the world. Let's jump right in. So for the longest time, the global response to HIV was, and this was absolutely the right call, a crisis response. I mean, it was an all-hands-on-deck emergency, right? The focus was laser-sharp on immediate life-saving treatment, just trying to prevent millions and millions of deaths. But then, science delivered what was, frankly, a miracle: effective antiretroviral therapy, or ART. And this just completely transformed HIV. It went from being a death sentence to a manageable, chronic condition. I mean, for millions of people today, living with HIV means living a long, full, healthy life. It's incredible. And here's the twist. That incredible success, it actually created a new, totally unexpected problem. See, our health systems were built for that old reality, these separate, siloed emergency clinics just focused on survival. But the new reality? It demands something completely different. Comprehensive, lifelong care that's integrated into the general health system. So the disease changed, but our systems, well, they haven't quite caught up yet. Okay, so let's dig into this huge shift. What does it actually mean to move HIV care out of the emergency footing and start treating it just like any other long-term chronic condition?
And that brings up a really important question, right? If HIV is now managed a lot like diabetes or high blood pressure, why is the care so often kept totally separate? I mean, why do patients still have to go to one special clinic for their HIV and then a completely different one for literally everything else?
Well, it's because the patient journey for someone living with HIV today, it looks a lot like anyone else's journey with a chronic condition. They're managing their ART long-term, for sure, but they're also dealing with things like hypertension, managing diabetes, and getting screened for other conditions like tuberculosis. It just demands a much more holistic, all-in-one approach. So what's the solution here? It's an idea that's actually beautifully simple but incredibly powerful. And it's really the core of what we're talking about today. It's called the integration solution. Basically, the principle is one patient, one health system. Okay, so what is integrated care in plain English? It just means no more separate journeys. It's about providing HIV services, testing, treatment, follow-ups in the very same clinic where you'd get a maternal health checkup or manage your diabetes or just get general medical care. It's all about creating a one-stop shop for a person's total health.
And for patients, this is an absolute game changer. Think about it. It reduces the stigma that comes with visiting a special clinic. It saves people precious time and travel costs. And when healthcare is just easier and less intimidating, it builds trust. And, this is the big one, it helps keep people in care, which improves health outcomes not just for them, but for their entire communities.
But hey, the benefits don't stop with the patient. This approach actually makes the entire health system better. It makes things way more efficient because you're not duplicating services. It builds resilience, so the whole primary care system gets stronger. And it broadens coverage, letting clinics reach more people in the community. It really is a win-win. All right, so this all sounds great in theory, but you might be wondering, how does this actually work on the ground, especially in places that don't have a ton of resources? Well, it turns out there isn't just one way to do it. Let's take a look at a few different models. The key here is flexibility. It's not a one-size-fits-all solution. So for clinics that are pretty well-resourced, that one-stop shop model we talked about is perfect. But in other areas, you might see a hub-and-spoke system where a bigger specialized clinic supports a bunch of smaller ones around it. In places with a shortage of doctors, task shifting is a huge deal. It empowers nurses and community health workers to deliver services. And for really rural or hard-to-reach populations, community-based models literally bring the care right to the people's doorstep. Okay, at this point, you're probably thinking what I'm thinking. This sounds almost perfect. It's better for patients, it's better for the system, it's flexible. So what's the catch? Why isn't this just how we do things everywhere? Well, as you can imagine, turning this vision into a reality runs into some pretty big real-world hurdles. And if we want to get past them, we've got to understand what they are. So take a look at this. The single biggest barrier, a whopping 40%, is fragmented funding. You see, for decades, a lot of global health aid has been vertical. That means money is specifically earmarked for one disease, like HIV. And while that's well-intentioned, it creates these funding silos that actually get in the way of integration. And then on top of that, you've got workforce shortages, weak infrastructure, and yeah, lingering stigma. But, and this is the important part, those challenges are not insurmountable. Not at all. The good news is we actually have a really clear path forward for building a stronger, more integrated system.
And here's the roadmap. Step 1, it starts with policy. Governments have to officially adopt national frameworks that support integration. Step 2, follow the money. We have to blend those siloed, disease-specific funds together. This is so critical. Step 3 is all about the people. Invest in training and empowering more nurses and community health workers. And finally, step 4, data. We need to strengthen our data systems with shared electronic records so we can actually track a patient's entire health journey, not just one piece of it.
There's this quote from researchers Robkin and El-Sadr that just hits the nail on the head. It says, "Why reinvent the wheel?" I mean, think about it. We have spent decades building these incredible, robust systems to fight HIV. So why would we start all over again from scratch to fight diabetes or hypertension? Why not leverage all that expertise, all that infrastructure, and all that passion from the HIV response to make healthcare better for everyone? And that really leaves us with a final powerful thought. This isn't just about improving HIV care anymore. It's so much bigger than that. It's about taking the hard-won lessons from one of the greatest public health challenges in history and using them to build something better. Could this model of integration be the very blueprint we need to finally achieve universal health coverage for all people, for all of their health needs? It's a big question, but it's one we have to ask.